Welcome back to our channel. Today we're discussing the controversial use of corticosteroids in treating septic shock, focusing on the findings from the Annane trial and how they compare to other major studies. Let's dive into the details. Among septic shock patients with relative adrenal insufficiency, corticosteroids were found to reduce 28-day mortality in the Annane trial, a finding not consistently supported by subsequent studies such as Corticus, Hypris, and Adrenal, yet reaffirmed by the Aprocus trial. Septic shock can lead to relative adrenal insufficiency, rendering standard IV fluids and vasopressors less effective. The Annane trial, pivotal in this debate, investigated corticosteroids' efficacy in septic shock patients with documented adrenal insufficiency. This landmark trial was a prospective, randomized, double-blind, placebo-controlled study conducted across 19 French intensive care units, ICUs, focusing on 28-day survival in patients who didn't respond to an ACTH stimulation test. The trial revealed a notable decrease in 28-day mortality among non-responders treated with corticosteroids, 53% compared to 63% with placebo. Additionally, corticosteroids expedited the reversal of shock. Contrasting results emerged from later trials like Corticus, Hypris, and Adrenal, which didn't show a significant mortality benefit at 28 days. Yet the Aprocus trial did support the Annane trial's findings regarding mortality benefits. Guidelines from the Surviving Sepsis campaign now recommend corticosteroids only when hemodynamics aren't restored by fluid resuscitation and vasopressors, suggesting 200 milligrams of hydrocortisone intravenously per day. The Annane trial's participants were critically ill, averaging 63 years, with diverse infections and high severity scores, most requiring mechanical ventilation and substantial hemodynamic support. Patients were treated with 50 milligrams of hydrocortisone intravenously every 6 hours and 50 micrograms of fludrocortisone daily, with ACTH tests distinguishing responders from non-responders. While corticosteroids reduced 28-day mortality and aided in shock reversal for non-responders, ICU and hospital mortality benefits were less definitive, with no significant one-year mortality difference. The safety profile was comparable between the corticosteroid and placebo groups, with a slightly increased incidence of surgical wound infections in the placebo group. In conclusion, the Annane trial endorses corticosteroids for septic shock with relative adrenal insufficiency, but mixed results from later trials underscore the importance of judicious patient selection and adherence to the latest guidelines. Thanks for watching. For more critical care and sepsis management insights, like, share, and subscribe. See you in the next video.